Okay, thank you, Phoebe. Thank you for the kind introduction. My name is Chia. I'm from Focus Point. So today we will talk about lazy eye. We'll be debunking some misconception because there's a lot of confusion over what lazy eye is. So allow me to introduce myself. I'm from the Training and Development Department. So I'm trained as an optometrist, and also I graduated from UKM many years ago, master's and also degree. So I've experiences lecturing for SAGI University, UCSI University. I've done training for Bolton Optical Group, which is slightly smaller, 50 outlets compared to Focus Point 200 outlets. It's a bit small. I've also done training for Bosch and Lomb, and I was also sitting in a committee for the Association of Malaysian Optometrists for about 5 years as their secretary, as their newsletter editor, as their organizing chairperson for several seminars. So that's a bit about me. So first of all, what is lazy eye? Lazy eye is when you wear glasses, your eye cannot see optimally. So we always say vision 20/20. 20/20 is also 6/6. It means that you can see very clear at far distance. So, but when you wear your glasses and you're not able to see your ideal vision, it means you have lazy eye. So it means that even with the right correction, like if you are -3, 300 power, you wear 300 glasses, but you cannot see 20/20. So in simple words, that is lazy eyes. So you cannot achieve normal acuity with the full correction. So what are the causes of lazy eye? So one of the causes of lazy eye is refractive error. So an example will be maybe one eye is -3, the other eye can be -10. So then the higher powered eye cannot achieve optimal acuity or the best vision with -10. So then the higher powered eye is lazy eye. Then strabismus is squint. So squint can also cause lazy eye because when you have a squint, your eye will divert out or divert in. It's not looking straight ahead. So that eye will have a lack of a deprivation of stimulus. So that squinting eye can also be a lazy eye. So you can actually have lazy eye then develop squint, or you can have squint then cause lazy eye. So it can be either before or after, but it's closely related. And lastly is deprivation. Deprivation can happen like, for example, the baby is born with a cataract, a white lens, so that eye do not get stimulus. There's no light going in because the cataract is blocking the light. So the eye with the cataract has lazy eye. So it means that some people, if they remove the cataract at 2 years old, so after removing the cataract, even with the full power, they cannot see because the eye didn't develop normally. So other causes of deprivation are ptosis, a droopy eyelid that covers the visual axis. So when your eyelid is droopy, it covers the seeing part of the eye, then it can also cause a lazy eye. So conditions like cataract that I mentioned just now, timely intervention is important. You have to send the kid for surgery, maybe within the first few months of life or first few weeks of life, to ensure that the eye develop normally and do not develop a lazy eye. So how does lazy eye affect our vision? So firstly is you cannot see normally, it's reduced vision, reduced visual acuity. Secondly is impact depth perception. So for example, like we want to drive, like want to reverse and park into a side parking, we need to be able to estimate the depth, the distance. So that one needs a coordination between both eyes. So what happens is if one eye is lazy eye, the two eyes don't function together normally. So you find that very hard to adjust. You cannot gauge, cannot estimate the distance. So that's impact depth perception. Then field of view is limited because field of view, like we see, this eye will see from here to here. This eye will see from here to here. So in combination, we see here. So, but if only one eye is seeing, one eye is not seeing, it means that maybe our depth of field is only here, but this side cannot see, if this is the lazy eye. So it will be impaired field of view, poor contrast perception, so like the eye that is lazy cannot really see color and different shades clearly, more vision problems, you will develop more problems, and also difficulty in eye coordination. So sometimes because the eye is lazy, not seeing that accurately, the two eyes when they work together is not so accurate. So that can happen. So how do you diagnose lazy eye? The simplest test is to measure your visual acuity, your vision. We read ABC, cover one eye, read ABC, cover the other eye, read ABC. Then we do an eye alignment test. We test whether the eye is straight, and we do a refraction. The last one is to actually test whether we have power or not. So we are able to know, with full power, are we able to see optimal vision? So that will actually tell us we have lazy eye or not. All this you can actually do it in a normal optical store. Yeah. But of course, if you bring a 2-year-old child, they haven't started going to school, they don't know how to read ABC, and we actually go to an optical shop, it's a bit challenging because we use the normal ABC chart. So maybe in those cases, you need to bring the child to a pediatric ophthalmologist, meaning an eye doctor for children. Then they are able to put drops and check the eyes more accurately because the patient cannot really give a good response. But if the patient is an adult or a school-going children, a child, then you can go to the optical shop. Any child that can read ABC can go to the optical shop. Then next, why is early intervention important? So why should we bring the child for an eye test once they are able to read ABC, assuming that they don't have much problem in school? It's because, first, because we want to maximize visual development. So if like they have -3, it's not a lot, but they still need their glasses to see clear at far. And some, maybe they have a +6. +6 is very high.
It's me.
Yeah.
I have +6. Oh,
yeah, you have -6. +6, some child, they are born with very high plus. That one easier to develop lazy eye. So if those are the cases, they need the glasses even earlier in life. Then also to prevent permanent vision loss, if you end up with a lazy eye, it's not treated early, no patching therapy done, maybe your loss of vision, your blurriness is permanent. So you need to detect it early and start some form of treatment. Then it will improve quality of life because it's like everyone is seeing with two eyes very clearly. You can see color very well, can see depth very well, eye also functioning very nicely together. And maybe you have one squint eye and one straight eye, and the squint eye cannot see anything. So you depend on one eye, so it affect your quality of life. So then also got long-term complications. Like imagine the one I give you example just now, -3, -10. -10 is very high risk of retinal detachment, glaucoma and everything. So, and if they end up with a divergent squint because of lazy eye, it can also affect the quality of life because he doesn't look normal anymore. The eye is squinting outwards. So it will affect their self-esteem as well. So quality of life is not good. Cost. So if it's not treated early, then it will lead to more problem and you need to treat it lifelong. So it will be a higher cost. And also, if you treat it early, the treatment is simpler. If you treat it later, it's more complicated. So it's to simplify the treatment or to have a higher efficacy for it to work better. It's better that we detect early when they are children, when they are a child. Yeah. So to sum up, lazy eye is loss of vision, impairment of vision that can happen due to unequal power, one very high, one very low. Can be due to very high power like -10 and -10 can happen. Can be due to strabismus squint, one eye deviating. And also can be due to obstruction of vision axis. That's the deprivation that we were talking about just now, the cataract or the ptosis. So it can happen because of that. So the prevalence, meaning the amount that is affected in the population, is between 1 to 4% of the children. And normally it's in one eye. So meaning there's a bad eye, a lazy eye. Normally it's in one eye. But there are situations that it can happen in both eyes as well. So, and we can normally give power. Normally if it's a child, we will give them the full power and start some form of treatment. Maybe patching and start vision therapy, maybe coloring, finding letters in a newspaper or something. So we want to force the eye to work. So patching, we will patch the good eye and we ask the lazy eye to work, to do coloring. Maybe we give them a newspaper, one page of newspaper, circle all the A. We give some difficult tasks to the lazy eye to force them to work. And when you go to doctors, sometimes they will also do something similar, but they don't use a patch. They use atropine, which is a drug that will actually blur the good eye. So then they will also force the lazy eye to work and do similar tasks. So there are some treatment that we can do if you have lazy eye. So the topic is also debunking myths or misconception. So what misconception do we have? So some people think that if my power is higher on one eye, anisometropia, then the higher power eye is lazy eye. So that is actually a misconception. Because if I have -3 and -6, both eye can see 20/20, it means I don't have lazy eye. But if I have -3 and -6 eye cannot see 20/20, but -3 eye can see 20/20, so maybe the reduced vision eye is lazy eye. So only if with full power I cannot see, then I have lazy eye. Okay, then the second one is lazy and Christ's eye are the same. So it means if I have 斗鸡眼, if I have strabismus or squint eye, so squint eye equals to lazy eye, not necessarily. So squint eye can be squint eye. We do have squint eye that both eyes seeing equally well, but the eye is alternating fixation. So sometimes the right eye will be straight, sometimes the left eye will be straight. So but both eyes also can see 20/20. So this person has squint but no lazy eye. Okay, so lazy eye is permanent. So lazy eye is not exactly permanent. Lazy eye is treatable, but you need to detect it early with therapy. So lazy eye can only be treated at a certain age. That's actually the older belief. Last time they say if you detect it after 7 years old, you cannot treat anymore. This is permanent, lifelong lazy eye already. But now the new researchers has found that even in teenagers, you can still do the patching therapy and it may show some result. And patching is the only treatment for lazy eye. So also not necessarily, it's the most popular treatment but not the only treatment. Yeah, and pediatrician and school screenings can diagnose lazy eye. So children doctors and the ABC you read in school, you know those nurses come, they cannot diagnose lazy eye because they only check vision in the school. They only can tell you whether your vision is good or not good. So normally not good, they ask you to make glasses. Then when you go to the optical shop where the optometrist check your eye, then they can tell you whether it's lazy eye or just normal myopia or astigmatism. So you need a proper eye check in an optical store. Ideally you see an optometrist if they are young, then you are able to diagnose lazy eye from that. So what are you waiting for? Make an appointment with Focus Point Optometrist. We have about 200 optometrists in the group now. So you can actually see our optometrist, bring your child along, check their eyes, have a proper refraction, a power check, and some binocular vision check. And we can actually help you diagnose or catch lazy eye early. Or even if they just need glasses, we can give them the full correction as and when needed. Thank you very much.
All right. So
Any questions?
So before this, I thought that we have a lower power and a higher power, then it means it is lazy eye.
Yeah, there's a lot of misconception. A lot of people misunderstand or think that the higher power eye is definitely lazy eye, but it's not necessarily.
So it's actually after you using glasses
and you still cannot see.
You cannot see 20/20.
Yeah, even with the full power, you still cannot see. That means that the eye nerves are weaker or it never developed properly, so you have lazy eye.
So if we have glasses on and we still can't see clearly, so we need to take some, we need to have some
Yeah,
checkup.
vision therapy, yeah. When you are still in school, then we can attempt some form of vision therapy lah. Yeah, and last time the misconception is also the longer you patch, the better. So you longer you force the bad eye to work, the better. But the new research has found that patching only need 2 hours.
Per day.
Only need 2 hours. If you patch 8 hours, it's the same result as you patch 2 hours. So that's the new research finding. So research is very interesting. They have a lot of new findings that actually remind us that certain things that we always practice is not correct. So you should always keep abreast of the latest finding. And like if you see that the other talks that was carried out earlier, they also do mention some new findings, some new researchers that actually teach us new things that is actually different from what we used to practice lah.
Yeah, very new information for us to know.
Yeah, new developments lah. Yeah. Any other
So
questions from the
our
floor
audience,
maybe?
any
Any
questions?
audience, any questions?
So that's all from Ms. Chia.
Yes,
And
that's
so
all from me.
make your appointment today with our Focus Point Optometries. So where
Yeah.
can we make this appointment?
Actually, we have optometrists in almost every outlets now. So it's basically every focus point.
So
the
we
whole
can-
group, including we have 9 brands: Focus Point Signature, Whoosh, iFocus here is also a focus point. We also have Optometrist Anggun. We also have iPhone, Focus Point Concept Store. Yeah, we have about 9 brands of optical shops under one roof.
So
So
we
we are
can-
all Focus Point Vision Care Group.
We can just walk in for this checkup.
You can, but sometimes the outlet may be busy. They will ask you to come back and make an appointment.
So maybe we can make a call first before
You
we...
can. It's ideally you make a call, make an appointment. They have the room ready for you. Then you can make the checkup once you come in. If you're worried that it's busy, so like certain locations like Mid Valley, better make an appointment. Mid Valley is very busy.
So before we go for the eye checkup, do we like need to take off the contact lens for more than how many hours? Or
For children, they are not normally on contact lenses. Yeah. For adults, you need to remove the contact lens the day before.
so 24 hours before the checkup.
Yeah, like tomorrow you're going for the checkup, you remove it
So
tonight.
today you
lah.
cannot
Yeah,
wear
yeah.
contact lens. Oh, okay.
So yeah, because normally if not you go in, you have to remove, then you have to wait. Yeah, so you remove it the night before, it's easier. At least the eye is rested and it's not swollen or anything, and you can actually go in and just have an eye test.
So we also need to like have enough sleep before the day we went.
Rest is important because we will put your eye through some exercise, 1, 2, 1, 2, 1 clearer, 2 clearer, which one darker, which one rounder. So if you have not enough sleep or rest, it will make the eye check more challenging. And sometimes the optometrist will tell you the response not very good today, please come back again. So rest is because of the eye check procedure. There's a lot of responses and attention we need. So it's ideally you come with enough rest so that it doesn't affect the eye check outcome. Yeah.
So before we go for the eye checkup, we call and make an appointment and rest our eyes well, and we can go for the eye checkup.
Yeah, ideally lah.
Okay.
Yeah.
So thank you so much, Ms. Chia.
Okay, thank
for
you,
your-
Phoebe. Thank you for listening.
Thank you, and
Don't
thank you
forget
everyone
to collect
here.
your free gift.
Okay, thank you.
Thank you.